Good evening, everyone. I am Dr. Vaishnavi Pradhan, and you are listening to another special episode of Respire Lung Cancer Awareness, One Voice at a Time, a joint initiative of NATCO Pharma and Voice of Healthcare. At Respire, we believe awareness is the first step towards prevention, and the real change begins when we come together to talk openly, listen deeply, and act with purpose. Lung cancer remain one of the leading cause of cancer related deaths in India. Yet it continues to be under acknowledged, underdiagnosed and in many ways misunderstood, especially in smaller cities and towns where access and awareness are still growing. That's why we are here to shine a light on the reality of lung cancer through the voices of those who live it, fight it, and support others through it. Today, I am honored to be joined by a clinician who brings both deep expertise and deep empathy to the field of oncology, Dr. P.R. Harish Kumar, consultant oncologist at Hamsini Cancer Care, Madurai. Working at the heart of a two-tier city, Dr. Kumar understands not just the science but also the social and emotional landscape that patient navigate. His perspective is especially vital, and we seek to decentralize cancer awareness and to ensure not just patient but their life. So, welcome, Dr. Kumar, to our session.
Thank you. And first of all, I would like to thank the organizers and the team behind this wonderful initiative and for having me for discussion today.
Yeah, so we are very thankful to the NATCO team for bringing this initiative in front of us. So, to start off our session, what are your current observation about the incidence of lung cancer in today's India's healthcare landscape?
Coming to the incidence of lung cancer, as we all know, it is increasing. It is increasing steadily over the years. And one major thing which we are seeing is that still the mortality rate is very high. Lung cancer is among the top five list. It is in the top five list for incidence in both genders, male and female, and also in the death rates. And the age adjusted incidence rates are also increasing. One unique thing is that we find more non-smokers, more women getting lung cancer nowadays, and also that there is a change in the histological types of lung cancer which we face. Usually, we used to get a lot of squamous cell carcinomas, but now we are getting a lot of adenocarcinomas, and also that the prevalence of lung cancer is very less. For such a high burden, the prevalence is very less, which means that almost majority of the patients are having early mortality. But with the latest advancements and in treatment modalities and screening, we should be able to bring it down.
Okay, so having said that, traditionally lung cancer was more associated with smoking, but these days we hear that non smokers develop cancer. So, can you elaborate more about it? That what is the current trend of lung cancer?
So this is a very well-known risk factor for lung cancer is that smoking. Uh, Both in Western world and in our country, smoking is one of the most important risk factor for getting lung cancer. And
We cannot hear or have. I think there's some problem with the internet connection, so we'll just wait for Dr. PR to join back.
Am I visible now?
Yes, you are.
A small technical problem. So, as we were talking, in non-smokers, some major risk factors include air pollution, as we know. And we have an index called PM 2.5, PM 10, which is like the particulate matter, which has a very small size in around the range of 2.5 microns. And it has been increasing in our country. And indoor air pollution due to biomass fuels, radon gas exposure, occupational exposures to asbestos, silica, and other fumes from diesel, and such factors are contributing to this. And another factor is very important factor is that the second-hand smoke exposure. Even people who are not smoking, they are constantly being exposed to smoke.
Okay, so other than the pollution factors, what are the other risk factors, such as some of the factors which are related to occupational hazard? So, if you can highlight that, which causes lung cancer.
Yeah, as we know, like exposure to asbestos is a very important risk factor for lung cancer. And there has been a lot of awareness on that over the years, and initiatives have been taken to reduce the exposure to asbestos. Likewise, exposure to silica and also certain chemicals like arsenic, beryllium from industries, even from the diesel fumes which we inhale. These have been classified as multiple levels of carcinogens, type 1, type 2, and the exposure is higher. One problem with this, unlike tobacco, we are not able to quantify the exposure to these occupational agents. And of course, usage of biomass fuels in indoor contributes to polycyclic aromatic hydrocarbons, which is also is potentially a carcinogen.
Okay, so now that we know the etiological factors that are causing lung cancer, how important it is to diagnose lung cancer at an early stage, and what upper hand it gives if it gets diagnosed at an early stage.
It is a very important question to discuss. The thing is that we spoke about lung cancer incidence and mortality earlier. And as I said, the mortality is very high. But if we are able to pick up lung cancer at an early stage, the survival improves drastically. The only factor which is preventing us from getting lung cancer diagnosed at an early stage is it is completely asymptomatic at an earlier stage. The moment you get a symptom, it is already advanced. So to pick up a lung cancer which presents asymptomatically, we should need a robust screening system to pick it up even before the symptoms come down. So another problem with screening is that lack of awareness and the widespread use of screening. As of now, we don't have any national guidelines to strictly implement screening. But what the Western world says is that anyone between 50 to 80 years of age with symptoms of lung cancer should be screened for lung cancer at an early stage.
We'll just wait for Dr. Harish to join back.
Hello.
Yeah,
Yeah.
yes, we
Where
can
we
hear
were
you.
in that staging screening topic. So
Yes,
the Western world has these guidelines that heavy smokers between the age of 50 to 80, they are advised to undergo a low dose CT scan every year to pick up the lung cancer at an early stage. And also, when we are implementing these things to our country, we should also take into consideration the amount of non-smokers who are coming up with lung cancer nowadays. Definitely, screening helps in finding up new lung cancers.
Yeah, so now that we know that this cancer can only be diagnosed at a like a later stage, but are there any early signs or symptoms which a person can notice and go for a screening to diagnose it at an early stage, or what are the alarming signs for which will help in diagnosis of lung cancer?
So coming to screening, I think screening should be done at a point when they are totally asymptomatic. There's no purpose of calling it screening when we have symptoms. But coming to symptoms, so usually when you have a symptom, as I said, we are going to have an advanced stage of a disease, either locally advanced or it has should have spread. So some signs of lung cancer could be of respiratory symptoms like breathlessness or a severe chest pain or a cough which has not settled down or getting blood in your sputum. So similar respiratory complaints which are not getting corrected with your regular interventions or which are persisting for over a period of time definitely need attention to rule out a lung cancer. And also some symptoms of cancers like associated with these symptoms like having a loss of weight, a significant loss of weight, a loss of appetite should also awaken our insight to look in for a lung cancer.
Okay, so now that we know that screening is a very important step in the journey of lung cancer, how readily is tools like low dose CT scan available in tier 2 and tier 3 cities so that the screening can be done easily?
So nowadays, CT scan machines are available almost in every tier 2 and tier 3 cities in our country. So access is not a big issue. Anywhere there is a CT scan machine, we can do these low dose CT scannings. The only thing is the lack of awareness and initiatives are needed to be taken to find the right people to screen.
Okay, and we have also seen like the trend of treatment is changing for lung cancer. So, what are the treatment options that are currently present or has changed over the years?
Lung cancer is one thing where the treatment has changed dramatically over the past decade, and particularly in the systemic therapy. Systemic therapy, which is the medicines which we give to the patients. Initially, we had only options of chemotherapy, but now with the introduction of targeted therapy and immunotherapy, the treatment of lung cancer and particularly the stage 4 lung cancer has been revolutionized. But advancements are not just confined to the systemic therapy. There are advancements in surgery with a lot of minimally invasive and less morbid surgeries coming up with advanced techniques in radiation therapy to precisely target the tumor tissue. And even in diagnosis with a lot of molecular testing coming up and also the liquid biopsy options where if you are not able to get a tissue, we are able to do the tests, molecular tests in the fluids, either it is the pleural fluid or the blood. So the advancements have been very drastic in this past decade.
So now that we have mentioned targeted therapy and immunotherapy, can you just break it down that what are these treatment options and how do they work?
So coming to these therapies, first of all, chemotherapy is basically how it is a cytotoxic therapy. We give some medicines, they go and kill the cells. It is as simple as that. So it can damage both the normal cells, so which is associated with a lot of side effects, which gives a negative impact to patient, negative view on patient's point of view. Coming to targeted therapy, it is a form of therapy where we target a particular genetic alteration in the tumor. So once we find out that there is this particular genetic alteration, we give drugs which will target only that alteration. So potentially the side effects are reduced, and also one as long as the target is not evolved, you can keep the tumor under control with the targeted therapy. Immunotherapy is another revolutionary option where uh, we make our body's own immune system capable of fighting the tumor. So, one mechanism how cancer develops is that it evades our immune system, it hides from our immune system and grows. And this immunotherapies make sure that our immune system are able to take care of the cancer cells. So side effect profile differs a lot between traditional chemotherapies and the targeted therapies and the immunotherapies.
Okay, so can you like quickly tell me that what are the what are the side effect differences between immunotherapy and the traditional chemotherapy that we had in
So
the past?
yeah. For example, with traditional chemotherapies, we'll have alopecia, loss of hair, we'll have mucositis, we'll have diarrhea, vomiting, with bone marrow suppression contributing to anemia, infections, and a lot of other problems. And our immunotherapies are usually devoid of all these side effects. They have a unique set of side effects, but they are not as common as the chemotherapy side effects. So, quality of life for the patient is way better with immunotherapy than chemotherapy.
Okay, so now we know that there are multiple treatment options that are available. So as a doctor, how do you decide that which treatment option is to be given to which patient?
So for deciding treatment, it majority of the times needs a multidisciplinary team meeting. So it is not just with a single physician deciding on the treatment, and we have a lot of factors from the patient side to take care of. So we take care of the patient factors and the disease factors. So the patient factors such as how good their performance is, how what comorbidities they have, how good they can tolerate the treatment will all decide it. So from the disease point of view, we should know the stage of the disease and the molecular alterations which the disease has, and also specific prognostic factors and predictive factors which could decide whether an immunotherapy option would be better, a chemotherapy option would be better. So we have to combine a lot of factors with also an involvement of a multidisciplinary team to get a precise treatment plan.
Okay, so now that we know the screening part, the symptoms and everything, so what are the barriers that are present in getting this treatment access for all the cancer patient in different parts of the country?
So this is a question which pertains to many people in our country. So though, as we talked, we know that there are a lot of advancements, but we still have a high mortality. The thing is that one major thing which divides the patient is their geographical location many times. So when they are in a tier three city, when they are where readily the super specialty services are readily available, they get treatment very early. So people coming from the tier two or tier three cities, the problem is that diagnosing the disease itself sometimes takes time. So they have respiratory symptoms and they keep chasing around different physicians and take different medicines. And when they land up to a point where they are diagnosed with lung cancer, they are already in a very advanced stage. Second point is that the financial constraints in our country to get access to treatments which are very advanced. Financial constraint is really a big barrier for many patients. Even sometimes when we pick up patients at a early stage, due to financial constraints, they might not be able to travel and take these treatments.
Yeah. So, having said that, along with the financial burden and everything, there is a lot of psychological challenge that a cancer patient suffers. So, what are those challenges along with the physical battle that they have?
Yeah, psychological factors are also very important, and there are a lot of cultural factors also influencing that. In many parts of our country, having a diagnosis with cancer is still considered a stigma, and particularly in lung cancer, when they are diagnosed with cancer, uh, commonly as we associate only with smoking, people feel that they will be termed as a person who has some kind of addiction. So, which is not the case always. And many people they have a fear that what if I go and test and get it positive as cancer. Uh, with that thought, they are not getting to that. Reality that if they get diagnosed earlier, they could have a chance of a cure. So this is something. And when people are dependent, like particularly women in rural areas, or when elderly people in a joint family, when they are dependent financially for treatment on others, then there are a lot of cultural factors which put their diagnosis and management at risk.
Yeah, so that also outlines that there is a huge role of caregivers in the treatment of lung cancer. So, what is that particular role that a caregiver plays for the treatment of lung cancer?
The role of a caregiver is as important as the physician and the patient. They are the one who are going to take the patient for their appointments. They are the one who are going to make sure they get their medications properly. They are the one who are going to make sure that the adverse effects are being communicated properly. And they have the huge responsibility of taking up the financial part of the treatment in most places. And another thing is that as like the cancer patients might have anxiety, depression, and a fear of death, these caregivers also have a similar emotional burnout. They also undergo severe depression, being with their loved ones, taking care of them, seeing them suffer, and which is something which we do not address usually. At least now we have some knowledge that we should be compassionate with the patients and address their emotional needs. But with caregivers, we usually do not consider it. We just ignore the part. And definitely, they also have a very significant psychological uh, problems in dealing with these diseases.
Okay, so are there any support groups or communities that are working in this direction, or it is yet to be discovered for the patient who are
So,
getting treated with lung cancer?
no. Nowadays, there are a lot of groups who are working towards these. There are a lot of NGOs, there are a lot of online platforms to provide support. But it is not very visible to a large population of people, and has not been yet very accessible to most population. So the important thing is that for having such communities, having within the geographical area of the patients is very important. So though India is a large country, and though we have a lot of NGOs and organizations working towards that, it needs a lot of expansion.
Okay, so as a physician, if you ever encounter a patient who has got a stigma about or a guilt of accepting lung cancer, how do you navigate that conversation with that patient?
So it is a very difficult part. And the main thing is that you have to listen to your patient. So many of the times, if you're going to ignore what they are telling, you're not going to achieve the goal. They'll be severely depressed. They'll be in anxiety. Sometimes the patient may keep repeating what they were telling again and again. You need a great degree of patience to listen to them. When you are able to listen to their words and acknowledge that first, that is the first step in getting the confidence of the patient. Once they gain a confidence in you, I think probably some of the mental disturbances will come down. And as their treatment progresses, they'll slowly understand if they're getting better, if their symptoms are getting better. They'll slowly understand. And this cannot be done with a single setting, or like it is not an acute treatment plan. Uh, the caregivers and the physicians need to work with the patients throughout the course of their treatment to handle their psychological impacts.
Okay. So now that we have understood like the lack of awareness or the lack of support groups around lung cancer, what are the other things that can be done at policy level or at central level in order to bring awareness about lung cancer?
So we are taking a lot of measures at central level, strict, but we will have to impose them more strictly. Bringing more restrictions on tobacco products would be a better idea, and also creating a lot of public awareness programs, incorporating them in the primary healthcare setting, educating the people right from their school levels to college levels would be a better initiative to create more awareness.
Okay, and how important do you feel it is right now to implement like a national screening program for high risk population?
Yes, it is definitely very important because we have a huge mortality from lung cancer. If and we have a huge amount of population which smokes heavily. So if we are able to pick up a lot of cases in the early part, we will be curing more patients. And this also contributes to an improvement in the socio-economic profile of our country. So we are losing a lot of human resource people, which is essentially the human resource of our country, to a disease which we can cure.
Yeah, so in terms of helping a patient getting any socio-economic benefit, so are there any like any progress in that world as well? Because we also had a conversation around that there is a lot of financial constraint for a patient to get treatment. So are there any groups that are working towards providing such financial benefit, or is there any progress in that direction as well?
Yeah, there is a lot of progress. One thing is that a lot of NGOs are coming up in helping patients with cancer. There are groups helping of patients of particular age, like pediatric population or a geriatric population, to get a cancer care. We are having fundraising programs for many cancers, which is also increasing. And also, the governments are working to bring cancer treatment more into these insurance schemes, the government insurance, the insurance of the employees, the private insurance. Work has been made. There is a progress in these areas, but we need a lot of progress in the future.
Yeah, so if you study this trend around you locally, what is the change in the mindset of the population around you? Are they more keen towards getting it diagnosed? Maybe the smoking groups only. Do they come for screening like on a regular basis, or is there any change in the mindset of people around you?
No, what I say is we still don't see a significant change in their mindsets. People who smoke have their own justice that not everyone who smokes get the cancer. They are not even aware that they are smoking and creating second-hand smoke exposure to people around them. And also, compared to screening, as I said earlier, people are worried that what if I get a cancer in screening? They're not ready to take up that call. They are not understanding the point that if you pick it up early, you will be cured. You'll save a lot of lives in that aspect. And also, I won't say the stigma or the things associated with cancer has changed a lot, but we are seeing improvements. See, in some sectors of the country, particularly in tier one countries, particularly among people who are educated, and we are getting more people educated in our country nowadays, and particularly in the younger generation, the awareness is rising. They're ready to bring up their family members for screening or treatment. So it is a hopeful scenario that probably in the next decade we would be in a better aware scenario.
Okay. So finally, as we are coming towards the end of the session, what is that one key message you would like to share to our viewers for maybe for a early screening or early diagnosis or the change of trend in the treatment? So what would be that one key message that you would like to give our viewers?
So my strong message would be that lung cancer is preventable and it is curable, and it is up to us to move forward in that direction. And we should be more empathetic with the patients. We should start having more open conversations. Having a conversation about cancer is not a stigma topic. We should have more open conversations. We should create more awareness. And definitely, we'll be moving forward in a good direction. And one more point, which I want to mention, is that lung cancer does not spread like any other infection, which is a big myth among our people even today. So you need not fear the people who have lung cancer.
And is there any live example also that you have had encountered in the past few days where maybe early diagnosis or not having a stigma has helped that patient getting treated or have a longer life with lung cancer?
No, as of now, we are not seeing much screenings. But as I told, younger generation people are more keen on knowing what things are happening, how to screen. So people are nowadays they're asking. So should I do some screening? Should I do some screening for my relatives? So that awareness is slowly improving.
Okay. So, yeah, that was a great session, and I think it has outlined many treatment option and the screening test and the policy level changes that we can have around lung cancer. So, yeah, thank you, Dr. Kumar. Thank you so much for taking out your time and sharing your insights and most of all your compassion for lung cancer. And it was a great initiative by NATCO Pharma, and I hope that our viewers get a great insight from this and they go for screening for getting lung cancer diagnosed at an early stage. Thank you so much for joining, sir.
Thank you.